This time of year, many of us are thinking about Thanksgiving plans, upcoming family gatherings, and what's going to be on that menu. You're probably not thinking about family health history, but you know what? You should be. That's right. To explain why is Dr. Kimberly Newton with Cone Health Center for Women's Health Care. All right, so first and foremost, this is going to be a good time, actually, to find out some family history with the upcoming holidays. When you fill out the forms at the doctor's office and they ask about family health history, what do providers do with that kind of information?
That is a great question. A lot of people wonder because those are somewhat invasive questions, right? So one of the most important things that we do with that is review that in relationship with your own individual health. It also helps us know if you need any additional screenings, maybe earlier than the general population. It helps us give you individualized care in the best way possible.
Okay, so while we're at the doctor's office, for some health conditions, it might change the recommended age to start some specific screenings. So let's kind of talk about those.
Absolutely, absolutely, because that's a really common question that we get in care. So, for example, for some individuals that have a strong family history of breast cancer, we just came out of Breast Cancer Awareness Month. Knowing that is really important. It helps us plan for earlier mammograms, helps us plan for potentially different types of screening with a breast MRI for some people. Another good example of this is colon cancer screening. So for the longest time, colon cancer screening was start at age 50, but now it's actually the recommendation has changed and we're starting at age 45. But if you have a family history of colon cancer in a primary relative, meaning like a mother, a father, a sibling, we actually do recommend 10 years before their diagnosis. So that means that someone even younger might need colon cancer screening. Other examples would be heart disease screening. Some people with strong family histories of heart disease may be eligible for calcium studies to see if there's deposition or if there's calcium in their heart. So all of these things help us know when, based on the guidelines, it's recommended for you as an individual to have a screening.
Right, and you'd rather be proactive at that than waiting the 10 years or whatever else of what you thought.
Correct, because when we catch these conditions earlier, we are able to intervene and help lessen the effect on your life. And that's the goal of any screening.
Okay, so a lot of people, though, think that if something runs in their family, like heart disease or diabetes or cancer, that they're all of a sudden they're like, oh, it's just a matter of time before I get it too, so I'm just not even going to bother with it.
Oh, I hear that all the time. And I think it can even feel that way as an individual, right? Just kind of signposting that that's a really normal feeling to have. But one of the things that you can, through good relationship with your primary care doctor, is try to affect that outcome, right? Even though diabetes might run in your family, through good counseling with your doctor, good lifestyle changes, you may develop it later or never at all. And so those are what we want to do as your doctor team, is partner with you to the betterment of your health. And it's not inevitable, right? These things are not inevitable. A lot of times the choices we make day to day actually do affect that.
Okay, so we wonder, like, how much of the family tree do we need to be like talking about? Do we need to include like aunts and uncles, grandparents, great grandparents, that kind of thing when we're talking about family history?
So the most important people to know the health history of are definitely your siblings, your mother, and your father. That being said, there are some family conditions that tend to run in families. So knowing one or more generations back is actually helpful as well. But if nothing else, knowing your siblings' health history and your parents' health history is really important for you as you plan, and also for your doctor.
And I know sometimes when they ask you stuff, they're asking you to circle, is it, on your mother's side? Is it on your dad's side? So kind of talk to us about just who is important to, like, who had what and at what age. Is that like stroke or heart attack? What figures in there?
Absolutely. So some of that is, we want to know the people who made you, right? So your mom, your dad, their parents, but then also the age at which something presented, going with the example of breast cancer again. So if we had a family member who had a young breast cancer at age 30, that's really important for us to know. It is also important to know about a breast cancer at age 80 as well. However, some of those More aggressive forms of cancer are often present younger, or heart disease and stroke in someone who was much younger. Maybe we're going to be a little more um, suggestive of interventions to prevent that outcome for the individual themselves.
Okay. You know what? You're about to be with all of your family. So this is the time that you need to be thinking about, hey, what do I need to ask people and when and why and all that other kind of stuff.